Okay, let's finish up the middle adult. For psychosocial in the middle adult, those who believe or who have achieved generativity feel good about themselves and comfortable with their lives. Those that are involved in altruistic acts, sometimes volunteer work becomes important to them, and then family roles change, and sometimes they become caregivers to aging parents, and sometimes they become grandparents. And with any of these things, they have to have support as aging occurs. You should encourage involvement in community activities and explain the need to care for themselves even while they're caring for others. That becomes increasingly important in any stage. If they are a caregiver to someone else, they tend to forget to take care of themselves as well. That's the reason that respite care is extremely important, and they still have the need that they have to get out and they have to do things, they have to take care of themselves and be involved in other things, or they completely lose themselves and their health deteriorates as well. So caring for self is extremely important in any stage, but especially in this one. um, they should be able to reflect on the past and anticipate the future. Reaction times diminish and learning abilities remain for the motivated person. You should encourage your clients to return to school or to participate in intellectually stimulating activities. Um, for morals, you have to be non-judgmental when you discuss their values. For spiritual, it's the time when they're able to appreciate others' belief systems and they're less dogmatic about their own beliefs. And religion is also almost always a source of comfort for them. So you should encourage the use of spiritual support, and you should refer them to clergy if they so desired. The major developmental task in this stage is generativity. It's that sense that they've contributed to society versus stagnation, a sense of non-meaning in their life. Evaluation of life at this point leads to that midlife crisis that you've always heard so much about, especially if one feels that they have little accomplishments or self-expectations have not been met. Um, you must assist in improving their health by identifying their risk factors and providing early intervention. And there are major risk factors, especially behavioral and environmental. You have to encourage them to assume responsibility for their own health. For safety issues, lifelong unhealthy practices now exhibit those adverse effects: the smoking, the drinking, the drugs, the lack of exercise. And then there are occupational hazards associated with their employment also, and those are a significant problem as well. They do have more time for leisure at this stage, so there is an increased risk for injury. Self-care teachings for middle adults include nutrition, exercise, weight control, stress management, health screenings, and then changes related to aging. In the older adult, which is age 65 to death, and the CDC estimates that by the year 2030, older adults will be more than double in population to 71 million roughly, which is about 20% of our population just in the U.S. There are demands associated with long-term care, and it's a challenge for them personally and for family resources as well. Now for the older adult, there are respiratory changes. Muscles become less flexible, and they have decreased vital capacity of the lungs. You're going to need to educate them about the importance of attaining that flu and pneumonia vaccine. The effectiveness of coughing mechanism lessens, so you have to make sure you're always assessing lung sounds, the effectiveness of the cough mechanism, pulse ox, and the need for oxygen therapy. There is less gas exchange, and the alveoli thicken and decrease in size and number. There are structural changes in the chest skeleton, such as kyphosis, which causes a decreased diaphragmatic expansion. And again, you're going to be monitoring for signs of respiratory distress. In the cardiac system, cardiac output declines, heart rate slows, blood flow decreases to all organs, and the arterial elasticity decreases. This causes an increased peripheral resistance and a slight increase in systolic and diastolic blood pressure. So your considerations for this are to arrange for and encourage regular blood pressure checks, monitor for signs of fluid retention, arterial and venous insufficiency, assess the apical and peripheral pulses, and educate the person about limiting dietary intake of fat, cholesterol, sodium, and alcohol, caffeine as well. And then you recommend a smoking cessation program if they smoke. Neurons in the brain decrease in number. There's decreased production of neurotransmitters, and cerebral blood flow and oxygen utilization decreases. So again, you're monitoring the general health status, monitoring for cognitive changes, and assessing the risk factors for stroke. Lacrimal glands secrete less fluid, which causes dryness and itching of the eyes. You're going to encourage regular examinations by an ophthalmologist. The lens of the eye becomes less pliable and yellows, resulting in distorted color perception. Make sure they have their glasses on. Accommodation to pupil size decreases, and the vitreous humor changes, which causes blurred vision. And those are all normal aging processes. Cerumen production increases, so they need to have their hearing screened regularly. The number of neurons in the cochlea decrease, and the blood supply lessens. There you have to assess for ear pain, drainage, and impacted cerumen, and ensure that they have their hearing aids in when necessary. Periodontal disease rate increases and tooth enamel thins. So you need to inspect the mouth regularly for signs and symptoms of dental disorders. The gag reflex lessens. So again, you're going to assess nutritional status and that gag reflex. They don't need a regular diet if they are not able to swallow or their gag reflex is decreased. Esophageal peristalsis slows and hiatal hernias occur. So you're going to educate them about avoiding the overuse or misuse of laxatives. Gastric emptying slows and peristalsis decreases. So you're going to discuss the importance of dietary fiber and exercise to help regulate the bowel. Liver size and enzymes decrease, which slows drug metabolism. So you're also always going to be monitoring for signs and symptoms of that. The drug metabolism has decreased and not having the therapeutic effect. Glomerular filtration rate decreases, which causes a decreased renal clearance of drugs. You need to monitor intake and output, complete an assessment for bladder management, and implement appropriate bladder management programs, because the bladder capacity also decreases, sodium conserving ability diminishes, and the bladder and perineal muscles weaken, and the prostate enlarges. So you need to encourage them to empty their bladder every 3 to 4 hours, whether they feel like it or not, and offer absorbent incontinent pads or briefs. The skin becomes thinner and less elastic, wrinkles develop, melanocytes diminish, and they get age spots. You're going to remind them about adequate protein intake and fluid intake to promote good skin integrity, and assess them for pressure ulcer formation. You have to remember that the eccrine, apocrine, and sebaceous glands decrease in size, number, and function, which gives them dry, itchy skin. The body temperature regulation diminishes. And remember, your elderly people are more susceptible to infection but don't always have a temperature. That the capillary blood flow decreases, melanin production decreases, facial hair growth occurs on the lip and the chin, bones demineralize, joints undergo degenerative changes, muscle mass and elasticity diminishes. You need to assess that dietary intake of calcium, protein, and vitamin D. Teach, encourage, and assist them to establish exercise programs that are appropriate to their capabilities, and teach them and their caregivers about measures to reduce the risk for falls and sustaining fractures. There are alterations in the production and reception of hormones. You have to monitor for signs and symptoms of hypo and hyperthyroidism. Thyroid changes lower the basal metabolic rate, and blood glucose levels increase related to the slowing of insulin release by the pancreas. So you're also going to have to monitor for signs and symptoms of hypo and hyperglycemia. In women, estrogen production decreases with the onset of menopause. And you're going to have to teach and encourage monthly breast self-exams and encourage annual gynecologic examinations. The uterus and ovaries and cervix decrease in size, vaginal lining thins, vaginal secretions decrease, and breast tissue diminishes. In men, there's decreased testosterone production, the sperm count and viscosity of seminal fluid decreases. The prostate gland also enlarges and impotency may occur. So for men, you need to teach and encourage monthly testicular exams, yearly digital rectal exams of the prostate gland. This is the time of integrity versus despair, and they usually seek an older person's advice. They've learned to accept their life as it is, and they identify and use the strengths, and they gain a sense of worth from helping others. And you should encourage socialization with their peers. There's no decline in the IQ associated with aging, but the reaction time does slow. So you have to allow time for responses and watch for medication-induced confusion. Short-term memory capacity decreases, but long-term remains unchanged. They want to make moral decisions to fit their principles and beliefs, so you should encourage that decision making and respect their values, even if they're different from your own. They are generally satisfied with their spiritual beliefs and act on those beliefs. You need to listen carefully to determine their spiritual needs and acknowledge losses and encourage appropriate grieving. During this stage of the older adult, there are certain psychosocial tasks such as accepting life as it is, finding meaningful activities, adjusting to age and health-related changes, coping with loss, and making preparations for death. You as the nurse have to assist them in developing a sense of well-being. They also assume new roles as grandparents, and they enjoy their family and friends. You need to assess their background, family history, work history, achievements, sense of self-worth, and hobbies, and encourage them to discuss life experiences. You'd be surprised what you find out with from some of these people and the experiences that they've had and the things that they've done and the places that they've been if you just talk to them and listen to them. At this point, there are about 44 million Americans that care for older families. Again, you have to be encouraged to respect the client values, support decision making, listen non-judgmentally. You have to help them put disappointments in perspective by reviewing accomplishments and achievements and encourage reminiscing. Wellness for these people includes health promotion and dependence, maximizing abilities and strengths, and encouraging regular exercise and activities. Safety concerns are mostly related to falls, so you're going to teach them ways to minimize. You're going to make sure there's adequate lighting, removing throw rugs or loose rugs, clearing all walking paths, putting handrails on the stairs, and installing handholds in the tubs in the showers. For older adults, medication polypharmacy becomes an issue. The side effects from one medication are treated with another medication, and they often doctor shop if they don't get what they need. They're given more medications, so they're on multiple medications with unknown consequences that result in some unusual combinations. And many times, because of their health issues, they're seeing more different types of doctor. They may have a primary care doctor, but they might also have an endocrinologist or a cardiologist, and all of these people are prescribing different medications for them. So they have to be reminded that they have to make each one of those physicians aware of what the other is prescribing and why, to make sure there are not multiple interactions between the drugs, and that everyone's on the same page. And I think that about wraps up the older adult, and that concludes then the chapter on the lifespan.